Investigation. These are the basics. Blood with FBC, CRP, chest X-ray, spirometry. Sometimes when people say that we do a routine test, that annoys me a lot. What do you mean by routine test? When you are organizing any test, you are trying to find out something. So in this patient, you are trying to find out the cause for cough. So how creatinine will help you in this case, or how, uh, amylase will help you. You have to justify. You cannot just write a routine test for everybody with cough. So full blood count, CRP, chest X-ray, spirometry, these are very much justified. Now, some additional tests that depends on your provisional diagnosis after taking history and examination, whether you book a serum IG, whether you will book a serum allergy test or a thyroid test, or even you try to find out, okay, could be a sarcoidosis, I think, after seeing some X-ray finding, you can do that. But nowadays, test is taking over many tests. That is T2 marker. One is pheno test and another is blood eosinophil. And I won't say induced sputum is that much common in our country, but blood eosinophil and pheno is really important. If the patient's cough is productive, yes, you have to do a Gram-Stain culture and a AFB. And sometimes if there is a fruity cough, but patient is not bringing up anything, then bronchoscopy with bronchoalveolar lavage, what we look for. We sometimes need to go for a HRCT or a contrast enhanced CT scan of the chest. Sometimes we have to do upper GI endoscopy or esophageal manometry. If we think about GERD, all this will help us to finalize our diagnosis and help with our management. But sometimes the initial treatment, if the patient responds, we don't need to go for this. We just can first 3 tests and 1 or 2 tests from this additional test, good enough to come to a diagnosis, and we can treat the patient nicely.